We get your food and we start talking. I think it's a great program that Sandra Stafford for us today. For those of you who do not know me, I'm Dr. Gonzalez. I'm the current president of the Hidalgo-Starr Medical Study. So I'd like to thank you for being here and your trust in having me represent you for this deal with all the major obstacles that we have to face every day with medicine. As you know, for those of you who have been here, as long as I have, and for those young ones of you that haven't been, I think that there are a few very important things that you need to keep in mind when you're coming to a community to practice. As a young physician, I was very fortunate to have a lot of the leadership in this community, really take me under the wings and teach me what it is that I needed to do in order to be able to navigate a lot of the changes that they were telling me were coming. And I can tell you, I never imagined that in the period that I've been in practice, the type of things that have occurred would have occurred. And many of them very good. I think a lot of them may not seem good to you, but I think they are. The advent of technology and our ability to take care of patients on a daily basis. And I think today, one of our speakers will give you an idea of just exactly, the power of what technology can do for managing your patients. From a representation, I mean, very often when I was sitting in the audience as a young physician, quite often I would hear a lot of physicians, say, well, why are you a member of the TMA? Why are you involved with Hidalgo County? They don't really represent me. And as I grew up, I realized that the only way they're going to represent me is if I'm involved. And I think I want to challenge all of you to make sure that you get involved in every aspect of what happens that you can. I mean, we're all very busy, and we can all do, with the advent of Zoom now, fortunately, we have the ability to be in multiple places at the same time. And sometimes I'm in 3 meetings at the same time. Don't tell Sandra. But it gives you that flexibility. And what I'd like to do for those of us who have been for a while, just continue to be involved, because we're on the latter end, very happy, but we're on the latter end. But I see a lot of young people here. We need to make sure that we do everything we can to get them into a situation where they continue to enjoy, practicing medicine as much as I have. When I look back, and unfortunately my daughters are not going to go into medicine, I'll tell you that, but when they look back and I say, if I was that age, if I was your age, would I do it again? Absolutely. This is the right thing. This is where I've been, happiest. This is where I've had the ability to develop my interest in everything, that has to do with medicine, including advocacy. Now, there are a lot of challenges that are continuing to happen. Medicine, corporate America is coming into medicine, and it's not a new thing. It's going to continue to come. And in my specialty in ophthalmology, the private equity groups have been very important. So when I go to my meetings, all the young people are, of course, very worried. Some of them don't realize what's happening, but the bottom line is, think about this: the private equity guys that are going to take care of the patients, they can't do it without you. And I think that's what needs to be in your mind. I mean, you need to be involved. We've done it in the past. We've done a great job without them. But I think a concerted effort between all the forces that are shaping medicine in this country, I think, will work well. But the bottom line is, without the physicians, the medical assistants, without the PAs, without all that medical team, it doesn't work. And the best way to do it is to make sure that you have well-structured physician, involved, services. And I think that's been something that's worked very well in this community and everywhere I travel, and so please be involved, get involved if you haven't already gotten involved. And it's very important because, as one of my mentors said, look, if you're coming to dinner, either you're involved in the menu preparation, or you're on the menu, or you eat whatever they give you. So I want to make sure that I emphasize it. Practicing along the border is very unique, and I think that many of us who are here every day don't realize exactly just how unique it is and what a challenge it is to practice here. Everything from everything that's coming across the border. The first thing that happens when I travel anywhere else is, "Are you okay? Is it really that crazy?" And I'm like, "Well, it's a challenge, but it's a challenge that a lot of physicians have raised to and have done a great job." I can tell you that a lot of the folks that came across the border when they were here, a lot of the members of this medical society, I'm proud to say, did a lot of volunteer work, many hours taking care of people, children, mothers, when they came across that border. And I'm very proud of all that dedication and work that many of you have done. And when I point that out, they don't know that. Those are not the stories that are being covered, right? But those are the stories that they need to hear, and we need to make sure that we continue to put that out. Um, because of that, there's a lot of challenges that we have being able to take care of everyone, right? We have one of the largest uninsured groups in the country, definitely in the state. And that's always a challenge, but again, the physicians in this community, both Cameron County, Starr, Hidalgo, all along the border, have always been very responsive and have done the right thing and just take care of the community. So I'm proud to tell you that we continue to do that. For those of you who have not heard of something called the Border Health Office, I encourage you to, again, look into that organization. I'm vice chair of that, and once I finish here, I guess I'll be president and chair of that one. And that one, what we do is not only work with the local communities, but just as important, or well, just as important, we educate all of our legislators to what really is happening in the community. And they give us an opportunity to educate decision makers from other states that have no idea the challenges and everything that you all are doing to take care of Americans in this country. And that involves doing local events where we have legislators come in, congressmen, senators from both sides of the aisle, to educate them on really what the challenges are and what we need. And then, quite often lately it's been a little curtailed because of COVID, but we also have some events in Washington where we gather the heads of the different important health departments. Right now, one of the unique opportunities that we have is that one of my classmates happens to be the wife of the Secretary of Health and Human Services, Javier. So that's been a very unique opportunity for us to go up there and educate them on some of the challenges. And it's not him because obviously he knows, but all the heads of the different departments we have an opportunity to interact. And that's the kind of activity that that's happening around you. And if any of that piques an interest, Sandra Caballero's at the office at all times. You can always reach her, reach me, and we'll all be very happy to make sure we accommodate you and give you a list of things that may be of interest to you within all of the advocacy work that we're doing in the community. So I guess I've said enough. I want to welcome everybody and thank you for being here. I think next I'll have there are a few changes that we've been working on, and Dr. Lenore here has been
we're gonna let her presentation first, because she's gonna help us present it so that we can. It's a bylaws change, so that we can vote more effectively, and I want you to be able to read the text of our proposed change. So we're gonna have Shannon do her presentation, and then we'll put Jeff the screen. So thank you.
We'll move next to that. Shannon.
That's okay, it's done.
See, the president doesn't mean anything else. We have a team of happening. Well, next up, I'll turn it over to you, Kyle. As I mentioned, there's a lot of very important things that are happening in technology. In our group, we've got a range of ages, and as you can imagine, the age range determines how interested and how knowledgeable we are in all these new systems and all everything from social media to all the competition. Some of the older guys say, you know what? I'm about to finish. There's no way I'm going to even bother doing that EMR. Here's my paper. I'm going to finish it. And he did a great job with that. But now I think you'll agree as we're beginning to integrate technology. Technology can be very important in our ability to manage patients and know what happens when they go to the oncologist, they go to a primary care doctor. As an ophthalmologist now, I have the ability to know when Dr. Science or somebody else starts one of my patients on a new diagnostic medications, for example, diabetic. If these are the diabetic, there are some systems now that will flag me now and say, hey, this is a potential eye issue. This patient of yours, the two of you now started on the diabetic drug. I think you need to address that with the next time the patient comes in. That is the power of what these systems can do. And I think Kyle will give you an introduction. Just a brief introduction he gave me, sounds like it's something that, that would be very beneficial to the patient. So Kyle,
thank you. Thank you. Does. He hit so many good points. It is a team-based approach now in care. With shortages in every level of healthcare and staffing, nutrition, turnover, it's really hard to support the chronically ill. We're a digital health and professional services technology company. We have a clinical call center here based in Edinburgh. I actually grew up in McAllen, Texas, born here in the hospital he now works at. And Renee's an advisor of our company. He worked with DHR. He's now with Regional. Mr. Batu is a friendly pharmacist out here in the community. And he's also an advisor. And really what we're doing in healthcare is improving access to care for the patients. We're helping the doctors spend better time with their patients, or more time with their patients. We're serving a lot of the, major issues in healthcare with underserved, uninsured, overuse of the ERs. We have 10,000 people a day turning 65. There's just, especially down here, the disease and at-risk population is through the roof compared to other parts of the country. Uh, Touched on the physicians and nurses and just the shortages. And then how do you get patients to be compliant? How do you get them to understand all this new laws, these new care models? And so we've done a lot doing that. You have a lot of patients that might have literacy issues. They aren't either technically literacy or they can't read at a certain level. So they end up going to get a procedure and then they don't comply and they get readmitted to the hospital. And then just lack of technology adoption. So when you look at all those things, these are a lot of the problems, right? You have physicians that are just busy, they have limited time, high staff turnover, unable to reach patients. They don't have the technology infrastructure in the practices. They have their EMR, their billing, their phone system, their email, it's all in different places. And then with patients, they have long appointment times. They might have to commute. They have troubles with access to care. They don't understand how to seek their care. They get a referral and they don't end up following through. So how do you control all that and have some types of checks and balances to keep them within a certain boundary? They might not be able to adopt technologies, or they're just not, don't rely on taking an order from the doctor and following through. They need some kind of nudges or way to help them to comply. So we can do a lot of those things. And when you look at the problems that we're solving, it's gigantic. It's one of the biggest expenditures in the country. There's over 100 million patients in the U.S. that qualify for this. In the past 5 years, there's been a ton of legislation, new care models, new payment models, and the government is really trying to incentivize doctors and healthcare systems to adopt what we're doing. I have a background in vascular general, obstetrical, and cardiac sonography. And so when you look at what we're doing by disease, we're now taking biometric sensors, internet communications, I have a monitor here, where as soon as a patient takes their vital, whether they have a flip phone with no Wi-Fi in their home, I can see whether or not they took their blood pressure and their glucose. And it streams automatically and goes right into the doctor or the hospital's electronic medical system. Same thing with pulse ox, weight, blood pressure, Apple phones, Android phones. We get all that data, stream it in, we make that data digestible, actionable, so we can take proactive measures instead of reactive treatment-based measures. The whole goal of this game is to keep people out of the emergency room. Pretty simple. The patient benefits, we're just totally changing and improving the overall experience. This is covered by Medicare, it's covered by Medicaid, so it's already funded. There is no cost. If they have an out-of-pocket, they have a deductible, co-pay, we have a hardship program. So we don't want to give the patients bad experience. We want to help improve their access, keep them out of the hospital, and the dollars follow. There's all kinds of Medicare incentives that again, the infrastructure and the systems and technologies just aren't in place to capture. The EMRs aren't made for this stuff. This is just coming in smart. EMRs were built years ago. So we're EMR agnostic. We integrated to all of them. Devices, to get these things FDA approved, it's cost millions of dollars. We don't want to compete in that space. We just integrate with all of them. We're device agnostic. They want to sell these, and so we integrate it through their APIs and stream in the video and make action. Doctors, 70% of doctors aren't billing these CPT codes or taking advantage of these new care models. On the fee-for-service model, 400 patients will generate a private practice doctor, $15,000 to $20,000 a month in net profit, recurring revenue. It doesn't take the time. It's all managed through our care team, through the call center. It increases practice efficiency. Think what happens when you go to the doctor's office and you sit in the waiting room. Phone's ringing the whole time, right? It's either someone trying to sell them something or a patient calling for help, right? So we set up a new phone number, we go to the doctor, go back 3 years on the next service, then we call the patient on a new phone number with their caller ID and let the patients know, hey, first of all, you're due for your office visit. Second, there's a new program that you qualify for. And we'll send them a little video of their doctor explaining it to them so that they can understand the new laws and how technology works and how we can really help them. So you probably think, well, man, it probably takes a lot of work, right? Like, we know doctors are busy. We know their practice is busy. We know the administrators are not looking for another job or another task or another responsibility. So we do it all. It's kind of like a white glove service, right? We onboard the patients, we verify their insurance, we check them by diagnosis codes straight from the EMRs. We then provide the virtual care management. We have some of our health navigators and onboarding specialists here. And we perform disease-specific and determinants of health-specific care pathways and protocols that are tailored and personalized around their condition level and their schedule, because if not, they're not going to use it. And if they don't use it, they'll use it. You got to get the patients in. Then you look at the enrolling, you're creating charts, doing all the billing collections. The only time the clinic or the doctor really gets involved is if the patient isn't compliant. When you escalate those charts up. So there's two main types of technology or competencies. We have the virtual care management and we have the revenue cycle management. They're integrated, complete digital audit care on footprint. At the end of the day, we improve access to care, we enhance patient clinical outcomes, increase patient compliance, and this results in new revenue streams, either through value-based programs, incentive programs, or these entirely new fee-for-service. So over 50 different CPTs have built the software around those original guidelines. So when you look at what the platform does, what is Smart Care 360? It has vitals, first aid emergency response, smart home activities, daily living, health and wellness programs that are determined to help and specific. We can connect family members to it. There's a patient portal, community portal with the group visits, and an admin portal. This is a timeline. I'm going to kind of bore you with how we got to where we got, but we're in stealth mode. Nobody knows that we exist. We've done something like this or picked up the phone and called them. The only marketing that we've done is the website is getting redone. We're about to let the world know who we are. We have all kinds of partnerships. We've been working with the state, with UT Health. They're now giving us PhD and master's degree students in epidemiology and bioinformatics to do studies, research, capture grant dollars, and just help us get to market, right? We haven't really announced who we are. So all kinds of different partnerships. We have a partnership with South Texas College. We donated software licenses to the school. They're teaching the students on this stuff. In classes, we're helping them write the chapter of the book, the textbook on this stuff. And then we'll take in their externs, and by this time next year, we should have about 300 employees right here in my hometown. So excited. These are some of our advisors. Sabrina came in town from Houston. She's a PA and a master's in public health. She's our director of clinical outcomes. Renee helps compliance, regulatory, just poking holes in my plans and making things a little more challenging so that we don't make mistakes that we don't need to make. Dr. Freumsen is ex-president CEO of Cleveland Clinic. He's also the ex-chief clinical officer of Trinity Health and medical director of Angel MD, which is over 30,000 doctors that all invest in startups. He's the medical director of that. Dr. Malcolm's the chief informatics officer and physician executive for DHR. He's on the advisory committee of Cerner, and then Dr. Valderas is the medical director and the founder of co-founder of Texas Gastro Institute. And she's they're a 3-year client. We built a gastro-specific vertical. This is built for mental health, primary care, internal medicine, doing a dentistry vertical. Every specialty we have a care pathway for. We do exiting, we're in the process of doing some investment stuff. If there's any interest, I'd love to talk to you about that. When you look at what we're doing for the patients, we have a platform that is in 17 languages. This is the patient view. The patient has a little dashboard where they have care tasks or specific challenges. We can gamify things. It can be step challenges, lose 2 pounds a week, take pictures of your food, things like that. And as they do this stuff, they get points. And then we have integrated gift cards with over 200 retailers to incentivize them to behavior change. We can also, all of the vitals that we take within the patient taking it within a few seconds, comes into our system. We have all of the different vitals that are disease. And then there's a whole historical trend, and we can kind of see the content and all that. When you look at the patient view, this is me and my account as a patient. Think of a chart. So we have IVR technologies, interactive voice response, calling, calls are recorded. We onboard the patients, we take them through these health assessments, so functional health, activity daily living, psychosocial, determinants of health. All those questions and answers become a credit score almost, from 0 to 25. We identify specific risk factors through algorithms, logic. So I put that I have a walker, I live alone, things like that. So we can identify all those things and take it into a care guide. And we can mirror the same care task that the patient has on their end, so that we can see what they're doing or not doing. And if the patient isn't compliant, we need to do a telehealth visit. We just click here, send the patient a text message. Patient would receive a text message. Doctor, nurse practitioner, medical assistant, health coach would click here. Camera's broken on that. While it's loading, we do have integrated revenue cycle management as well. So we're able to track all of the time, all of the billable instances, whether it's value-based, incentive models, managed care contracting, fee for service. We're able to see, so I'm able to track that now, do a telehealth visit, tracking the time here. Here's all the different codes we can build. And based on whether you're a doctor, a medical assistant, a nurse, physician assistant, nurse practitioner, they all have different credentials and different billable opportunities. So we can track that time based on their access and help them capture the revenue that they deserve, right? So that's what we do here. And on the dashboard, we're able to just really get the patients or the healthcare organizations or financial kind of departments. Let's run that slow. Just a view of kind of what's going on with the AR report coming out, and how month to date, if there's any registry denials, that's the historical kind of revenue month. But thank you for your time, appreciate your attention. I don't know if there's any questions. Your time. So the government started to mandate a new standard, which has expired, which is and what that is, it's just it's a coding language that we're able to really just connect with that with bidirectional data.
So no, basically, no matter which EMR we have now, at this point, is that you can have now a lot of different services coming in. Whereas in the past, they did have the proprietary way to block. Now with the new changes, you can have, now have different services packages in your EMR. So whether you're Epic, whether you're Athena, whether you're whatever those big plans are, there are a lot of services now that you can look at that can, come in and give you an opportunity to use the services. And again, I think technology has really been a very important aspect. I mean, one of the most important things that I learned was, the challenges we've had after COVID is trying to hire enough staff back, and I will set up three interviews and none of them show up, that kind of stuff. Especially when it's in your revenue cycle management. One of the best things that I found, as you pointed out, was there's a company that does artificial intelligence. So it does all my conversations, it sends out all the records, get my injections, clear, my back, make sure that I have all my contract rates and posts everything. I have a secondary, just one other that I think is available. For those of you who think that, this is something that might work, I think you need to look at it. The next thing I'll talk about is telemedicine. Medicine, of course, came of age, in a rapid way because of COVID. It's not anything new, but because of COVID, we've had a lot of opportunity to utilize this service. And everything from Shannon will talk about the whole gamut of what's happening to medicine. Certainly, there's a lot of changes that have happened from a state law standpoint. That was also some of the interesting problems that we had. Over time we had one company, we have multiple companies doing that. And I think that even within my specialty, it's been something that's been very important. Not having to have a patient come back for me to give them instructions on how they're doing with the medication is going to really helpful. But having said that, there are some nuances that you need to know about, and I'm sure Shannon will talk to us. Shannon, those of you who are not aware, is